Thank you very much. And this is our community, the MeatRx platform. We have, I'm not sure how many people in it. We've got 40 people right now, probably more will join. For you guys that don't know, I'm going to introduce Csaba. Csaba is one of the primary principal people behind the Paleomedicina group. I think he's the prime founder. I know he, Sophia Clemens, and a few others are participating. They've done thousands and thousands of people. They use something called the Paleolithic-ketogenic diet protocol to treat and manage all kinds of diseases, including autoimmune diseases, cancers, diabetes, to name it. And we'll get into that. And he's been doing this for many years. He's published several case reports in the literature on a number of cases that we've seen that. I'll let him explain the diet, but it is primarily meat-based. And with that, welcome, Csaba. It's good talking to you again. I look forward to seeing you in person later this year in August. But if he has anything he'd like to say in opening, that would be great. And I think we're being interpreted right now. So.
Well, first of all, thank you very much for having me. Yes, indeed, we've been working on this diet for 10 years now, which is quite interesting because it looks very much that we are the only ones who have, clinical practice experience with this, not only theory. And we manage lots of health conditions, lots of diseases. And I think it's been confirmed that the meat and fat-based diet is the healthy diet. PKD, paleoketogenic diet, is different a little bit from the carnivore diet, but in many ways, it's pretty much the same. And one of our principles is that we need to have ketosis. We've been working with lots of international colleagues, and we had sort of revolution because we have lots of doctors, physicians joining us, and we have, about 20 plus staff members who've been doing this and only this PKD. We also have a inpatient department. We have outpatient department where we use a paleoketogenic diet. What we focus on is gut permeability. We do research, we do tests. Of course, the two things are very much, the PKD and the gut permeability are very much interconnected. We are the second laboratory dealing with this relationship with the gut permeability and how PKD affects that. And if we take the number of tests, if we take the volume of data that we have at hand, maybe we are absolutely global leaders because data is very important to confirm what we are doing. It is a very important fact, to say what's important in terms of why supplements are not okay and why gut permeability measurements and tests are important. So in a nutshell, that's what I can tell you about ourselves, about our team. We've been in the last 2-3 years dealing with autoimmune patients, cancer patients, glioblastoma. That's one of the diagnoses where we could have quite nice results because of the ketosis, and it's all connected to the natural biologic membranes and how those work. That's so much on my behalf to introduce ourselves, and of course I'm very open to your questions, to your comments, remarks, and I'll try to give you more details. Thank you.
Yeah, I want to delve a little bit more into gut permeability, and I want to talk about how that relates to the pathogenesis of other diseases. Now, I'm seeing, obviously this carnivore diet has a lot of similarities. There may be some people that have a little bit different ratios of fat to protein, but in general, what we are seeing is profound improvement in pretty much almost in a panacea-like effect with lots of things, including mental health, which I think is fascinating. I've seen some people with things like Ehlers-Danlos syndrome, which is as you probably are aware, a genetic disease. What is it about the gut permeability, and how does hyperpermeability, which is usually what we're seeing, or malpermeability, if you want to use that term, how does that affect in a larger picture? What is the cascade of things that are happening when we have altered gut permeability with regard to other disease states?
We have a number of diseases and conditions where we have gut permeability in the background. Allergies and autoimmune diseases, that's for sure. And gut permeability and independent lab tests clearly show that. The other thing is where you have a very specific impact on how biological membranes work and how that impacts rehabilitation and the course of the disease, and that is cancers. Let's start with that, maybe because we have less experience and less data there, worldwide, I mean. Let me tell you this. In case of cancers, we clearly see that gut permeability is way higher than in any other diseases or in normal people. And of course, we have the blood-brain barrier, for instance. We have in the liver the same, membranes, biological membranes, where we have, a kind of a border, between two tissues. So there are lots of biological membranes in our body, and that's one example in the gut where we have such a biological membrane, but that is the one which we can measure. So if we, and that's, how the logic works. If you have a higher permeability in the gut, then probably you have a higher permeability in other membranes as well, on the one hand. On the other hand, it's the intercellular communication. Right? The communication can be only perfect if you have perfect permeability. You have the junctions, right? Which convey various chemical information messages. So if I eat, for instance, hot pepper, then permeability is going up, but that also means that other biological membranes change the way they function, and that is a kind of loss of communication, or at least it's a bad communication that develops because of that. So the body, because of the poor communication, loses control over how the physiological processes go on in the body. So if either carnivore diet or PKD, gut permeability goes down to the normal level, communication between or among cells goes back to normal. That is if you have a diet based on animal meat and fat. The other thing is where you have not just to study the impact of gut permeability, that you have to study in order to find out what you can do in order to improve the health status. But there are other conditions where it's in fact the etiological factor, the gut permeability. The disease develops because of bad gut permeability. So basically, if you have that, then lots of substances go through proteins, mainly the membrane, and get into the bloodstream, and then the whole immune system gets in a disordered status because there are substances which should not be there, proteins, polysaccharides, which should not be there, should not be in the body, should not be in the bloodstream. So that's a sort of an intruder. The immune system identifies that as an intruder. It's like, when you have bacteria or you have viruses, if you go back in time like 20,000 years, you didn't have a pathologic gut permeability because of foreign substances, because of, proteins or polysaccharides. People got that only because of bacteria and viruses. And, the body of those people back then fought against those intruders. And now we have the same thing, not only because of viruses and bacteria, but because of all sorts of other substances which we consume, which we ingest, eat, without having to do that, because that is doing harm to our body. So the whole thing is happening again. So if we take that out, those substances, then our immune system will get back to normal. And that is the whole thing. If we start PKD, then we will not have protein-like substances. We will not have polysaccharides in our body, because the spatial structure of these substances are very much like the shape and the spatial structure of our innate substances that we have in our body. And that is because they are very much like our own proteins. Then our body cannot fight against those substances, because our body, our immune system, thinks that those are own substances. So that's one of the reasons why we should avoid eating those substances, having them on our diet. And that is why we have all sorts of autoimmune diseases, allergies, eczema, and so on, because our immune system cannot find those substances because they are so very much similar to our own. So that's the basic of the autoimmune processes. So this is how the so-called immune complexes are created, right? And either it's a carnivore diet or it's PKD. They are very much similar, as I said before. These are very efficient because they eliminate this pathologic gut permeability. And because the body does not have those substances anymore in the bloodstream, then it's like a miracle rehabilitation process that can be initiated. Like a Crohn's patient, for instance, you can have within weeks a very nice recovery at least from the acute phase. And then the other thing is that sometimes it's not only or not that much proteins, but mostly polysaccharides that go through the membrane, and they get into the bloodstream. They get into, or via, for instance, the respiratory tract. They get into the bloodstream, and that's why we develop allergy. And if you can get rid of that, then you can block this pathologic process. So, and maybe this is, it's very difficult with the classical medical science, because classical medical science has been looking at this for tens of years, and classical medical science thinks this is a very complex process, although it's not that complex in terms of what is the etiologic factor. The etiologic factor is there, and it's very simple to identify, and it's very simple to get rid of. So maybe that's one of the things why classical medicine is so reluctant about all this. But if you have that either carnivore diet or the PKD, then you can get rid of these substances. You can get the normal level of gut permeability. And I can tell you that now we have this routine, testing, and we can confirm that if you can get rid of these substances, then things go back to normal.
Csaba, thank you for that. There's a question that Phil has about compounds, and so I'd like to put this into a more general concept. You talk about substances, and it seems like this is getting worse. Our diet has devolved into where we have a lot of chemicals, and you talk about supplements. What are the things that seem to be different from what they were 100 years ago? Because 100 years ago, people weren't having, I guess we don't have a real way to accurately measure this, but we've had, acute rise in all kinds of chronic disease. And there was a time when not everybody was eating nothing but meat for 10,000 years or so. And then one of the compounds often we see is oxalates, which are found in a lot of foods. And there is some thought that oxalates kind of crystallize and then go into solute and recrystallize again. And is there any special concern about any particular compound and how you manage those things? So what are the, like I said, what are the top things and I know I've asked you this before, the top things that seem to be really problematic for gut permeability in our diet. And the other question I would ask on this is, are there things outside of diet that can affect gut permeability, such as stress, such as sleep, other lifestyle factors that also we need to take notice of?
Well, that's a very interesting question, because gut permeability has been tested, analyzed theoretically in many ways, but there's no, quantitative testing. We know about 5 labs which do testing, and there are 2, and ours is one of the 2 labs which really do the testing. And we not only look at the figures, but we also look at, the connection between the figures, the data, and the clinical pictures. And we have lots of data at hand. Let me give you one example. Palm oil. We tested palm oil in patients, and we saw that patients having palm oil in their diet had higher gut permeability levels, and that's true for other vegetable oils as well. I'm not going to enter into details into which plants contain oils and other substances which increase gut permeability, but it's 99% of the plants. It's like the wolf after the rabbit. It's 50% chances that the rabbit can get away, but this is not the case when we digest those plants. They cannot run away. They cannot run away. So what they do is that they just synthesize substances when digested, which do us harm, because they cannot run away. They just cannot get away from our digestive system. So if they are there, then they are going to start doing the harm. And that is what we can show with our tests, and we have lots of data at hand, and we are going to be able to publish that. So stress does not really have an impact on gut permeability. Of course, if you are committed to carnivore diet or PKD, that's another thing. But if you are in stress, then you eat different foods. You start drinking alcohol, for instance, and that changes gut permeability. If you are committed, of course, to PKD and you are stressed, that's a different issue. But stress in general can induce higher gut permeability because you change your diet, you change, lots of habits and things that you eat and drink. The same with the various states with sleep disorders or psychological disorders. Oxalates, we did not look specifically into that, but one thing is for sure, PKD and carnivore diet, these 2 diets contain very few plants that contain oxalates that can have a negative impact on gut permeability and on the body in general. So if you take an average person, I think they have lots of food on their diet which have a negative impact. Lots of foods that contain lots of substances, including oxalates, but not necessarily just oxalates or just specifically one kind of substance that have a negative impact on the gut permeability, but lots of others. And of course, again, many have been doing research on this all along the years, and again, one thing is for sure, in medicines, in drugs, you have lots of substances. For instance, substances which are rice derivatives, for instance, which are there in the drugs, which again increase gut permeability. Those have lots of chemical and physical properties, these derivatives, for which they are used in pharmaceutical manufacturing. If you take, for instance, a beta blocker, or if you have paracetamol, for instance, again, not necessarily because of the active pharmaceutical ingredient, but because of the excipients used in drug manufacturing, those drugs lead to increased gut permeability. So that's why I am warning my patients about taking drugs. Now the supplements, again, herbal supplements, dietary supplements. Who should take them? What supplements should be taken? Again, here we have data. We have confirmation that virtually there are no supplements which do not increase gut permeability. And again, that's because all of the additives, all of the excipients, for instance, the rice powder, which I just mentioned, those are there in vitamin C, for instance, and in other supplements and vitamins, for instance. So if someone takes them, then again, they have gut permeability. And let me just share with you this. Gut permeability. If you look only at the health status, you have to consider two things, which are not probably very well known. Autoimmune processes and gut permeability are result of a qualitative reaction, not quantitative reaction. Let me give you an example. If you are vaccinated, BCG, it's 0.1 milliliter of vaccine that you get. Still, if you live for 100 or 120 years, you are going to be, protected against tuberculosis, because that is a qualitative reaction, not a quantitative reaction. And the other thing is how the immune system works. I'm not going to bore you with all the details, but the process which I told you about, the autoimmune processes and the immune system, we have the dendritic cells which convey immune response, triggering responses, even when the substances are not even there. So that's kind of memory that's created. So even before the substance gets there, because of the dendritic cells, the immune system knows how to respond. Let me give you an example. Milk, eczema, right? The milk protein. Probably in the medical history of that patient, there was milk consumption some years, many years before. And the reaction was there. The dendritic cells just memorized that reaction. And even if the patient stopped drinking milk for many, many years, but after many, many years, even one molecule of milk protein gets into the body of that person, immediately the dendritic cells will remember their first encounter that they had with that protein, and the whole process will be triggered. So zero tolerance is the only way to avoid those reactions. And if you are on carnivore diet or PKD, then you are on the right track to avoid those reactions.
Csaba, I want to get into the ketosis aspect of this because, some people on a carnivore diet are in ketosis. Are you a proponent of ketosis 24 hours a day, 7 days a week? Is that necessary? Is that necessary for certain conditions like cancer? Because I know you have a version of the diet in which there are like honey and some, a few fruits and things like that you guys, at least a few years ago, it was 70% meat and then up to 30% plants for certain conditions. So how do we distinguish when we need strict ketosis versus maybe not such a strict ketogenic type diet?
Let's start with the basics. Ketosis, maybe you are familiar already with this. Energy is produced. There's a mathematical formula. If my body is in ketosis, and my energy is derived only from fat, then I am able to produce threefold more energy from fat, from lipids, than using sugar or glucose. Okay? So basically this means that I need to consume 3 times the same amount of meat as compared to fat to get the same amount of energy as from the fat. So if you are on a carnivore diet, or you have the fat and meat based diet, then you are on lipolysis, so you produce energy from fat. But if you consume sugar, you need to consume 3 times more food, but that's only one thing. The other thing is that you have lots of byproducts, right? And your body, in order to get rid of those byproducts, need to produce all sorts of other substances. And this whole thing, it's a self-triggering process. So the more you eat sugar, the more byproducts you have, the more processes you need to have in your body to get rid of those processes. So that's why if you have a cancer patient, it's very important that you don't weaken the body of that patient. So let me just answer simply this question. If you have 24/7 ketosis, then you are really helping your body to get rid of all unnecessary processes and unnecessary substances. And if you are on a carnivore diet or PKD, then your body does not produce any substances that would need extra processes, extra energy to get rid of the substances which are absolutely undesirable for the body. So, and getting back, the more you have sugar, glucose, and other things that are decomposed by your body generating byproducts, then the more energy the body needs, and the more waste is produced. But if you are in ketosis, then the higher are the chances that the given person can get rid of all sorts of pathologic processes, does not need to mobilize extra energy in order to get rid of those byproducts, the free oxygen radicals, for instance, generated when decomposing sugar or glucose. So I think that's one of the most important differences between carnivore diet and PKD. And for instance, if you look at the Western diet, it is the first step would be, in my view, to have at least 2 days per week when you are in ketosis. And again, getting back to the gut permeability, if you are on PKD, then you can normalize, you can lower your gut permeability. So we are looking at the inflammatory factors, and we look also at gut permeability, right? So that's how we know that ketosis is good for the body. And as I said before, in cancer patients and in autoimmune disease patients, we clearly see that we cannot start the healing process. There is no curative intent if you cannot get the patients in ketosis. That's why we recommend the PKD in all these patients.
I want to just talk a little bit more about gut permeability, the way you guys measure it. I know you guys use a PEG 400. Can you talk about how that actually measures gut permeability?
Yes, that's right. There are several methods, 2 main groups: direct testing and several indirect tests. Direct tests is about lab parameters which are tested, and that's how gut permeability can be measured. The indirect test methods use various substances which are ingested, and then those substances are tested in the urine or in the blood, in the plasma. So PEG 400 is ideal because that is totally neutral, does not react, does not interact with any substance in the body. So for instance, if I get a urine sample from the US or from Australia, that's a perfect sample when we get it by mail or per post. Then we can use that. We can measure that. So there's no interaction, there's no decomposition, there's nothing that alters that substance, and it does not interact with any other substance in the body. Mannitol, that could also be an alternative, but that has some sort of interaction with substances in the body. So we chose PEG 400 because that's the ideal substance. That's the completely neutral substance. It does not interact with any other, external physical or chemical factors, and it does not interact with any substance in the within the body. So the patient just drinks the fluid, which contains PEG 400, and depending on the gut permeability, a certain amount will be absorbed in the plasma. It's going to be excreted in the urine. We are going to test that. We use chromatography to measure the amount which is excreted in the urine. It's not that simple to measure because in the urine you have lots of other substances, but we have our test method to identify, the PEG 400s, and we have analysts in our lab who've been trained, who are certified to do the measurement, so they can tell exactly the level of PEG 400 excreted in the urine. And it takes about 3 weeks to perform the test, and we get samples from all over the world. And we have a university center in Eastern Hungary, at the chemical department, where we have our dedicated lab. The test is performed there. We see the results. The results are sent back to the patient, and of course, we are physicians, and as I said before, we can interpret, we can read those results, and we can come up with hopefully meaningful advice to the patient in terms of what should be done, what exactly can be done in order to improve the condition of the patient. And as far as we are concerned, we're almost 100% sure that based on those advice, if the patients follow those advice, then their health status is improved.
Csaba, I'm without going into a lot of detail on a lot of these, I'm going to try to get a couple questions answered from our listeners here. And one I want to ask about, a lot of people are sort of questioning whether probiotics are helpful or not with regard to gut permeability. Some people are asking things like coconut oil. I would be curious, maybe, what about eggs? I mean, these are just practical things that people will sometimes include. One of the concerns is that many people see sometimes that their vitamin D level drops. Do we need to supplement something to improve our vitamin D? Is there anything? I would suspect the answer is no, but is there any sort of way to assess gut permeability realistically outside of, one of these sort of lab tests, PEG 400 mannitol or something like that? There's no easy measurement we look at on our body and assess what our gut permeability is.
Okay, let me start with probiotics. If you are on the right diet, then the gut flora will function normally. So if someone, a vegetarian, a vegan, for instance, if they switch to PKD or carnivore diet, within 2 or 3 weeks, months, they will have a normal gut flora. and you cannot speed up the process. You cannot speed up the process by having probiotics. As long as you don't feed the bacteria, you don't need to do anything, right? Because whatever the bacteria you have in your gut, if you are not giving any fodder or food to them, they are not going to survive, right? Eggs, vaccines, right? In every country in the world, you have vaccines. Here in Hungary, we have really a high level of vaccination. We use lots of vaccines. In the UK, they don't have as much as we have here in Hungary. But for instance, we have lots of vaccines, and each and every vaccine here in Hungary is egg-based. You know, they are inoculated, extracted, and the whole thing is processed. So there are inevitably egg proteins or fragments of egg proteins there. So, and that's going to trigger autoimmune processes. So as long as the patient does not have a normal, stable gut permeability, they are absolutely forbidden to consume eggs. If they have a gut permeability in a normal level, then they can start eating in small amounts of eggs, in small amounts. Coconut oil. You asked me about that. I said palm oil, but that's coconut oil. So we had this little study, and we had a number of patients who had coconut oil on their diet, and we measured the gut permeability, and the gut permeability went up the very moment they started eating consuming coconut oil. But that's true for all sorts of vegetable oils. Vitamin D supplement, you asked me about that. Well, I'm not going to enter, as you asked, into too many details, but let me just share with you this. It's just the autoimmune processes, the qualitative and quantitative aspect. We have the active and inactive vitamin D in our body. In our lab, we measure the inactive vitamin D levels, but you can only convert the inactive into active D if you have the perfect system in your body, in your skin, in your kidney. Alpha-1 hydroxylase, that's the enzyme that converts the inactive into the active vitamin D. And many researchers who do not have anything to do with nutrition established that if you have fructose in your diet, that enzyme is going to be inactivated. So, for instance, if you use a supplement, right, to convert that inactive vitamin into active vitamin, but after having that supplement, you eat an apple, then you inactivate the enzyme, which would convert your supplement, your vitamin in your body. So, and that's been established independently from the diet, from PKD. So that's one thing that's very important to keep in mind when we talk about vitamin D supplementation. So what you really need to have is the active D vitamin in your body. And it's very hard to say how you can ensure that you have that level. But one thing is for sure, if you have low carb, if you have ketosis, then the need of your body to have vitamin D goes down. So the level that we measure, that's a mean level, that's somewhere in the middle, that's good enough. And you can keep that level even during winter time. So in our protocol, when we start treating our patients, we give this vitamin D bolus. It's a big shot. It's 200,000 international units over 4 days to our patients. That's a huge dose. And that's going to stay for months in the body of the patient. So that's going to be there, and that's going to be, an insurance that the patient has a high level of active vitamin D. And of course, if that drops to a critical level, we recommend supplementation, but never in a continuous way, but we use a single high dose of vitamin D, and then no supplementation is needed, so that we can avoid situations when we have high levels of inflammatory factors or high level of gut permeability. Hope that makes sense.
Yeah, Csaba, and it kind of sort of supports some of the literature I've read looking at Inuit, where they saw Inuit with relatively low serum levels of vitamin D. If they were not consuming carbohydrates, they did not develop conditions such as rickets. But if they were consuming high levels of carbohydrates, then they did develop those things. So it seems like the serological amounts are dependent upon what else is in the diet. So that makes great sense. And so the other question I like to talk about is a little bit about fasting. Do you see a benefit towards autophagy, infrequent meal patterns in conjunction with either PKD or a carnivorous diet? I know a lot of people find that there's a lot of benefit from fasting. I'd like to get your thoughts on that.
Oh, I don't think fasting is a good direction to go. In fact, I think it's a very bad one. Indeed, fasting can make people feel better, and that can make people think that's going to be the solution to their problem, because that's going to be, it's like going around things instead of being very strict. You can eat anything because you are going to fast afterwards. That's kind of escape thing. But I think fasting is not okay, because if you do not eat, then you are getting low levels of essential substances. You get low levels of vitamins. If you have a thin person, after 48 hours, there's no way that the person would not start decomposing its own reserves, which is a very harmful thing. So that's one of the reasons why I think fasting is not a good direction to go. And that fasting does convert your body to ketosis, but that's different from ketosis generated by carnivore diet or PKD. If you have PKD, then your body is in ketosis because of consuming the right types of foods. But just think of an 8-year-old child, for instance. If they start not eating, they are going to start consuming their own reserves, right? And then they are going to lack many substances, essential substances for development. So when people say, okay, let's do fasting because that's going to help, that's very simple. If I drink milk, if I have cereals, and I don't eat meat, for instance, I'm going to develop a syndrome, lots of symptoms. And if I stop eating those things, I would start feeling better. So if I fast for 2 or 3 days, that's going to be good for me. That's going to be a very subjective feeling of, okay, I'm doing better because I'm not eating the harmful substances, right? So this is just a mere coincidence, but it's not scientifically proven. So I don't think fasting is a good idea. It's not confirmed in terms of physiology. It does not have any advantages over PKD or carnivore diet. And we never do fasting with our patients. We sometimes have short periods of fasting just to detect, the origin or the etiologic factor of certain symptoms or signs or conditions. If we have, let's say, 48 hours of fasting and the patient still has those symptoms or signs, then we can say, okay, your problem does not have a nutritional origin. It should be solved in another way. So if you do fasting for 48 hours, fine, you can have that. But if you have patient diseases, then definitely not fasting is the way to solve the problem.
Yeah, I think there's a distinction, and with this is semantics around fasting. I know a lot of people will talk about fasting being 48 hours, 72 hours, some people even up to a month. And a lot of us find out that naturally our appetite results in infrequent meal patterns, which is we might only eat once, maybe twice a day. Are you opposed to that sort of situation? Because what I see is this. Maybe it's a semantics. Intermittent fasting is considered, within a 24-hour period where you might only eat, twice a day, and that's what I find myself naturally, not because I plan to do that.
Well, I can again bring some examples from our practice. When you use glucose in your diet to produce energy, then this is what happens. I eat 100 grams sugar. 80 grams are going to be deposited. 20 grams are going to be used for energy, right? And when my blood glucose drops, I'm going to feel the hunger because glucose level controls that feeling of being hungry or not. And it's going to be fat and triglycerides, right? That's how the 80 grams of sugar are going to be deposited. But I cannot immediately convert that fat into sugar, into energy, right? But if you are in ketosis, then you are going to be able to convert that immediately. Right? That sugar, but that ketosis means that you immediately are able to produce without sugar energy that you need by decomposing the lipids. So indeed, as you say, our patients sometimes eat 2 times a day or even just once a day, and we even advise them to eat whenever they are hungry. And it's a learning process, indeed, as you said. You need to learn the pattern. You need to develop the pattern for yourself. It's going to be a little bit like, tailored to the needs of the patient. So it depends, how fast the patient can learn this, to 2-to-1 ratio to consume, say, lipid and protein, animal protein. And they can learn how, with that pattern, how soon they are going to get hungry again and how much they can reduce the protein level and having that fat on their diet, how long periods of fasting ensure or can provide them with. But again, that's a learning process. And after 1 or 2 months, patients will learn that, okay, if I eat this much of fat and meat, I'm not gonna feel hunger for I don't know how many hours. And the same thing goes with, for instance, very, very small amounts of sugar, of honey, for instance. Again, patients can learn how much they can consume of that, which still gives them the control not to eat too much of that kind of sugar.
Csaba, I want to just, with clinical ketosis, there's sort of been a, Steve Finney and Jeff Volek and others have kind of put this 0.5 millimolar as a definition of nutritional ketosis. And also the 2-to-1 ratio. I mean, I wonder, and I talked to Jofia about this a little bit, about, the end point is this glucose ketone index being the actual goal here. And it might not exactly be 2-to-1. For some people, it might be slightly more, slightly less. And it just seems like the 2-to-1 is kind of, more or less just an arbitrary number with a little bit of room on either side. Can you talk a little bit how we define ketosis?
Yeah, indeed. Well, if you look at the clinical side, you need to measure the ketone body level in the blood. The other thing is, when we discharge patients, it's very important that patients follow the pattern learned at our clinic. So we say it's 50 grams fat that you need to intake in order to have ketosis. That's over 1,618 beta hydroxy butyric acid concentration. So for that, I think the 2-to-1 ratio is perfect. Sometimes you can reduce that ratio. Sometimes you can increase that, and still you cannot see the results that you wish for. Water, for instance, that can change again the picture. If you drink too much coffee, you can get out of ketosis. But still, I think the 2-to-1 ratio, at least at our clinic, if they use the 2-to-1 ratio, in 4 days, our patients can get into ketosis, starting from scratch. And then you have the 2-3-1-4 or whatever ratio. You need to always look at the therapeutic effect. The 4-to-1 fat, protein to fat, or the other way around, or 2-to-1, it's hard to say which is more effective. But the bottom line is, ketosis, in our view, is when glucose is below 4.5 or even 4. Professor Selfig introduced in our clinic this practice of measuring glycemia and comparing it to whether the patient, or establishing whether the patient is in ketosis or not. And that does not necessarily relate to 2-to-1, 3-to-1, 4-to-1 ratios. As I told you before, after a certain while, patients learn the pattern. And we together with the patient, we know what's the right ratio. But again, 2-to-1 depends. Okay, it depends on the weight of the patient. But in adolescents, for instance, in young adults, I think the 2-to-1 ratio can have a blood glucose level of 3.5, and indeed, stress can have an impact on.
Somebody asked about insulin. Do you find that insulin can impact the gut permeability? I know, obviously, the type 2 diabetics, we hopefully can get off their insulin. And I know you guys manage a lot of type 1 diabetics that you've seen actually come off insulin, particularly if you catch it early enough. But does insulin itself affect gut permeability? And then somebody asked about your own personal diet. Are you on the PKD diet? Do you eat any plants? Does coffee cause gut permeability issues?
Okay, let's start with the end. I started by saying that either carnivore or PKD, I definitely think that this is the healthy diet. We have confirmation of that. I've been doing this, and my colleagues, the staff here, have been doing this for about 10 years. There are some certain food types, groups, which I would never eat. Milk, dairy, legumes, cereals, vegetable oils, synthetic sugars. I would never have that. Sometimes I eat more meat and less fat. Sometimes I eat more fat and less meat. The only compromise I do, that's coffee, indeed, and very rarely tea. And I use honey. That's what I do, indeed. Which is not necessarily, coffee and honey, a necessity for my body. I have to admit that. But I used to have Crohn's disease, so I was very motivated to do the research and to start digging deep into what can improve my condition. Diabetes, I think type 2 diabetes can be 100% healed, no matter whether it's tablets or it's insulin, no matter how long the patient has been diagnosed with type 2 diabetes. By nutritional intervention, we can cure that. The same thing goes for gestational diabetes. And we are very proud having many babies, with mothers getting pregnant while in ketosis, babies being born while their mothers being in ketosis. So, the tissues are more flexible. So it's very different. The quality of the pregnancy, as we were told by our patients, is different very much when the pregnant woman is in ketosis. Type 1 diabetes, we are sort of pioneers in this matter because there was no experience in this field before. But last year, for instance, our results were confirmed by French researchers who said that indeed ketosis is a way, or paleolithic-ketogenic diet is a cure to diabetes, to type 1 diabetes. And they did not have they did not have our results, but at least they could also show that insulin production can be very well controlled with this kind of diet. And the key here is, how you can reach ketosis in these patients. Because type 1 diabetes patients are in a very difficult situation. If they, if you have an obese patient, an eczema patient, and it's very hard, to get results with those patients. You need like 12 months, 18 months to get the first results. But if you have an autoimmune patient, diabetes 1, very young adolescent or a child, well, you need to be very strict about this kind of diet, and we need to explain them that the only way to achieve results is to be very strict about the diet, and that's very difficult. But not only we can stop the decrease of own insulin production, but we can start very slowly, steadily increasing own insulin production if we can have patients on this kind of diet. It's very difficult, but results are there, and really hope is there. So if we take out some certain foods, dairy products, for instance, let's start with that, then we can start having very nice results with diabetes patients. And insulin resistance, that's very much a fashionable diagnosis, right? In our clinic, by PKD or carnivore diet, within 24 hours, that condition resolves. So you can reach that no insulin resistance status within 24 hours. So I think the very definition of insulin resistance is not a definition. It's just a condition. If you use carbohydrates, then you can have insulin resistance. If you get rid of carbohydrates, you will not have insulin resistance. That's what I think.
Csaba, I want to thank you. Unfortunately, our time has run out. I've got to unfortunately go to another meeting. This has been absolutely wonderful. I mean, maybe we can do this again in a part 2 if you're willing to do that. I want to let people know that if you are interested in measuring your intestinal permeability, we will have a link set up so you can get this test done by Csaba's group. They have an American liaison to help us to do that. I think it may be interesting for some of us to check those things, particularly if you're dealing with disease and you can see if your intestinal permeability is improving. I want to thank the interpreter for making this happen. I think that and I want to applaud the work that Csaba and Chopia and the other members of PKD have done. I think it's done a great service to the world, and this is part of what inspired me to do what I'm doing. And I think we can really make a huge difference, and as this community grows, and the guys at the folks at the PKD or paleomedicine are a huge part of this, and so I think this is something that I think is just wonderful. And unfortunately, this has been recorded, so we will have this for posterity. And if Csaba and Chopia and any other members of the group are willing to, we would love to host you guys again. So thank you very much, and I'm sure the members of the group that are watching it now and will be watching it later will also echo that.
Thank you very much for having me. Take care. Goodbye.
Okay, I'm going to end the meeting, guys. You guys take care. We'll see some of you, rest of you guys tomorrow. Bye-bye, everybody.